Good evening, everybody. So I welcome you again to another very interesting episode of our health message for this evening. Just to remind you that we started our series on health information with diabetes, and then we progressed on to talking about yesterday night about sleep. And then I'm hoping that people have started sleeping appropriately in a bid to reduce sleep difficulty. So for tonight, I want to talk to us about hypertension, what we typically would refer to as high blood pressure. So there's hardly a person who sits and looks at me from whatever part of the world you find yourself that would say that hypertension is a strange word or is a new symptom or disease that they're hearing for the first time. So when we say hypertension, we refer typically to people who have blood pressure. When measured, the upper value is above 140, and then the lower values are way above 90. So you see people say blood pressure of 140 over 90 is hypertension. So both words can be used interchangeably. So what then will be normal blood pressure? That means you have a blood pressure of 120 for the upper value and then 80 for the normal value, which a whole lot of people who are healthy typically would have, including our pregnant mothers. So, but then you must have heard people say that hypertension is a silent killer. That's very correct, because hypertension shows no sign or symptom when it is just starting in an uncomplicated state. So some people would walk around the streets not even knowing that their blood pressures are high. Just on Friday, when we started this evangelistic meeting, someone came by the free medical clinic to check his blood pressure, and we recorded 220 over 150. And then he was walking the streets of Port Harcourt freely, not noticing that one day he could drop dead. And then we told him that this blood pressure is high, and his response was he had never been told, he had never checked, he has never known. So the advocacy for this message this evening is, wherever you are listening to me at this time, it's important that you check your blood pressure. We regard it as a vital sign because it gives us information on what next best step we can take. But because our series has been on lifestyle, we will try to conclude by telling you what lifestyle options you can follow to reduce your blood pressure. So you see, if you're waiting for symptom for your BP before you either take your medicine or before you actually check whether your BP is high, you are very likely to be putting your life in danger. So everybody needs to know what their blood pressures are. You must check your numbers. So make it as a habit. Every time you find yourself close to a clinic, kindly check. Every time you find yourself around a pharmacy, most pharmacies now have an opportunity to check blood pressure. So when your blood pressure readings are too high, very high, and then you're already in a complicated state, you would likely have very severe headaches. You become severely anxious. You're worried about everything. You might even have shortness of breath. Sometimes you cannot even lie flat on your bed without a pillow. Sometimes you can have bleeding from your nose and all sorts of horrible things that can happen. Just so you know, blood pressure can affect every cell or organ in your body. And so it's important that we check, because high blood pressure is a medical condition that must be treated urgently. So you will go to a hospital, you'll be asked to bring your arm, and they put a very fine-looking cuff, a cloth over your hand, and they press a bulb. Sometimes it's an automated machine. It reads a value, and they tell you blood pressure is normal, blood pressure is high, and then you need to be placed on medication when possible, or given lifestyle counseling, as we will share shortly. Some people can have blood pressures as much as the value I shared here, as much as 180 over 100, 110, and not even know it. And then they keep taking paracetamol, not knowing that there's a primary cause of the problem. Just to remind you, there are several things that can put you at risk for having high blood pressure. Besides the fact that if you have parents who are hypertensive, you're also likely to come down with hypertension if you do nothing about it. People who smoke or stay close to people that smoke, that means you inhale the smoke from a smoker, you put yourself at risk of not just having heart diseases, you are very likely to also have, for pregnant mothers, children born with low birth weight. So when they are delivered, their birth weight will be small, and then you might have risk for lung diseases. So we have known from everyday science that people who intentionally avoid cigarette smoking, whether they smoke it or they avoid people who smoke it, they stay away from that environment and avoid alcohol, they are very likely to have less risk of having a heart disease. So BP usually would rise, like we said yesterday, fastest early in the mornings. And so it's important that if you're a hypertensive patient, your blood pressure medicines are best taken during the day. So we also said yesterday, if you recall, that not sleeping appropriately, as at sleeping in the night and having sufficient 7 hours of nighttime sleep, you force your blood pressure to remain high, and then you're at risk for hypertension. What lifestyle options do we have to follow quickly before we choose to pray and ask the Lord to have mercy upon us? The first part is nutrition. So as much as possible, as simple as drinking water is very healthy. Rather than drinking Coke and fizzy drinks and carbonated drinks, and those ones you need to, well, has a lot of sugar in them, avoid those kinds of things because they put your heart at risk for very severe diseases. We've seen in one study done in the Asian area that as simple as 3 minutes of physical activity every day can sufficiently reverse your risk for blood pressure. So you don't have time, I cannot. Start simply, do as simple as 3 minutes of walking, extend to 5 minutes, and then progress on to 30 minutes and as much as you can tolerate. That has been shown to expand your blood vessels, and then blood pressure can fall without prescription medicines. So we also saw another research that showed that as simple as going on vacations can help your blood pressure to lower. In fact, the study showed that women who take vacation at least twice a year are 8 times likely to have less risk for heart disease. So all of our women, it's important that you take a break from all of the stressful things you do because you're at risk for hypertension, and then studies have shown that relaxation can also help you reduce your blood pressure. So take your time out, go to your villages. As you spread the gospel, remember to relax, and that can reduce your blood pressure. Being connected to your friends, your family, staying socially connected has been shown to reduce heart disease. Coming under the early morning sun, allowing yourself to have a sufficient sun bath in the early morning sun just before 10 a.m. has been shown to improve your blood pressure. And more importantly, connecting with Jesus, being spiritually connected to Christ has been shown to be helpful because you have trust and you have faith in the one true Messiah that we serve. That can sufficiently reduce your blood pressure. Just remember that eating right, exercising, sleeping, managing your stress, and avoiding alcohol can sufficiently help you to lower your blood pressure. At this point, I want us to bow our heads as we pray. I want you to pray for everyone that you know that is struggling with hypertension. They have had hypertension for several years on ending. I want you to pray for anyone you know that is having a heart disease. Just bow your heads wherever you are across the globe and ask that the Lord should have mercy on that one individual who at this time is suffering from hypertension. Even our mothers who are pregnant, they are at risk for hypertension. They are at risk for losing that baby. Bow your heads and say, Lord, have mercy on that woman who is at risk of losing her baby because of hypertension. Bow your heads, ask the Lord, take care of our aged mothers, our fathers who are at risk of dying from hypertension, from one form of heart disease. All of those people who have no idea that their blood pressures are high, like the man we saw in the clinic. Just tell the Lord to have mercy. There are people who know that they have hypertension, but they don't have the means to access treatment. Pray that the Lord will open doors of favor for them and make a way where there seems to be no way. Let us begin to round up our prayers. May the Lord hear our prayers in Jesus' name. Dear Father in heaven, we thank you because you are God and you're the one who makes all things beautiful in your time. So we pray for everyone across the globe who one way or the other battles with hypertension. So Lord, today we pray that as they take their medicine and adjust their lifestyle, their hearts and their blood vessels will be made whole. We ask in Jesus' name. Thank you so much.